Hey folks, General Manager Tony Mazzucco coming to you with our weekly Facebook Live. We're going to get started in just a moment with a variety of COVID updates and some other updates on town activities and other items. And of course, we'll take questions as we go through, and we've had a few questions sent in that we'll answer throughout the course of today's live. I do want to give a quick thanks to Stephen Ellinger, who is filling in for Joe today and is our behind-the-scenes help with our live, getting information out there on the question feed. So we are going to go ahead and get started in just a minute as folks log on. So the first few folks that log on, as always, we appreciate if you comment in the comment section so we can know that the live is broadcasting correctly, although it usually seems to be. And we'll get started in just a moment. Looking for my new favorite chart to show everyone. While we're waiting, I have a Mustang Gator, as they're called. I got this one at Day Street Sports. I think they're pretty flexible and pretty easy to use. We're looking to see if we can get some made with the town logo. Would be kind of cool, but we'll take the Mustang logo. So all right, we're going to go ahead and jump right into talking about some of our COVID numbers. Hey folks, thanks for joining. We had another positive is not always the best word when we're talking about testing results. We had another good week. I'm going to show once again for everyone our chart in Norwood. See if I can get this nice and even on the screen there. So technically a zero case count for the last couple days, but we're going to talk about some of those smaller data fluctuations in just a moment. But if you look at this chart, once again, it proves that we did in fact flatten the curve here in Norwood. Hi, Rachel, Doris, Michelle, and Katie, and everyone else for joining. So I'm going to highlight once again and show this to folks. Look at that. Look at where we were in April, where we had 107 cases in a week. And then we had the last 4 weeks, 0, 4, 7, 1, 4, 9, 1, going backwards. We saw our slope increase, go way up, and then drop down. As we have posted there in the comments, 5 cases in the last 14 days and a 1.25% positivity rate. Now, I want to talk about that positivity rate. It's not related to the total amount of testing. It is the percentage of the tests that are testing positive. So even if our test number went up or down dramatically, or the number of people positive went up or down dramatically, what we really want to zero in on is what is that positivity rate. Right now, we're below the state by quite a bit. We do want to be cautious about avoiding small statistical changes and what those mean. So an example would be that is sometimes folks will look at the state numbers. Now, one number I pay particular close attention to is the number of folks in the ICU, and that's continued to drop week by week across the state. I think the last time I looked, the number was in the mid-50s for the number of people in the ICU. Now, an increase in 5 or 6 people, one way or the other, statistically seems like a big increase where, oh wow, if we went from 55 to 60, the number of people in the ICU increased 10% or decreased 10%. But we want to make sure we focus on statistical significance. The difference of our test rate of being 1.25 versus 1.4, 1.5, or 1.0, 1.1, our numbers overall are so low in Massachusetts and here in Norwood as well that we're really still within that margin of error if they tend to fluctuate a little bit. Looking at our case count, where in the last 3 weeks we've had 2 0 weeks. 4 cases seems like a giant jump, but we're always going to have, with such small numbers, then they're going to seem to fluctuate a little bit more. So we're going to want to see what, you're going to want to look for not only a much larger increase to have some statistical significance, but the reason the states move towards a 14-day look back as opposed to just looking at it in its totality is we need to look at the trend of where those numbers are going. If they happen to use 14 days, in addition to it being 2 weeks, it also happens to be really the start in the potential incubation and spread period for COVID. So if you're in contact with somebody who's COVID positive, by the time you would become positive, show symptoms, get tested, some of your people that would need to self-quarantine, get tested and get positive, it's really a 14-day window. I did say about 3 weeks ago I was really waiting to see how the numbers would be in 2 weeks because I would feel more comfortable then with where the numbers are. We're now 3 weeks out, and I tend to be a cautious person, so I keep saying, well, wait another week, wait another week. But what we do know is that we have been doing inside dining since just after the 4th of July. So we've got more than 2 weeks of data on that, 3 weeks of data in that. And incidentally, many restaurants are reporting not too many folks are interested in indoor dining. Question about the shirt. I'll show the shirt in just a second. So we're still seeing mostly outdoor dining, but what our numbers have shown us is that we have been able to manage the spread of COVID in retail stores, with outdoor dining, in grocery stores and in our day-to-day interactions because we're following good protocols. Every time we open something else up, there's always a risk. But we've been doing well because we didn't see an increase in numbers when we went to outdoor dining. We didn't see that increase with indoor dining, although it's still early. All along, we've stated that our numbers and what we see here in Norwood, because we know where every case is, we are not seeing the spread out there in the community. Most of our cases, better than 90% in the last few weeks, even though there's only been a few of them, are large gatherings. So I don't want to sound like a party pooper, but we really got to be cautious about having large parties. There's nothing wrong with having a few people over. But when you start getting into the backyard parties with 25 and 35 and 45 people and how close people are, that's where we're seeing the spread. So our data is coming in quick enough that we can actually see in real time, almost real time I should say, with a several day delay, where it's spreading and where we're getting the spread from. So for the duration of the summer, really, and into the fall, be cautious about large group gatherings. And as we talked last week, it's really about the type of interaction you have in a party atmosphere, in sort of a party or a backyard party atmosphere. 62 patients in the ICU as of yesterday. 8 jumped yesterday. However, they're having data issues. That's true as well. That with the number being so low, a fluctuation of 8 or 9 people seems statistically significant. It's not. However, if that number jumped 8 and then it went up 8 the next day, and then 9, and then 7, and then 8, we would start to see that upward trend, and we would say, uh-oh, what's going on there? I'll show the shirt briefly. I had these made up. It says, in 1775, Aaron Guild said, Aaron Guild, of course, being sort of on our town seal. We've got this Norwood. So I had a few of these made up for some of the team in the office here and the health department staff figuring that out. As we all know, Aaron Guild answered the call of his community and his country when he ran to defend us. The battles of Lexington and Concord, and we feel that that's still a great motto for Norwood today, saying we've got this Norwood. Question or a comment from Haley about the summer camps. We are not, we're actually going to talk about some of our camp and positivity processes. We're not seeing anything from the camps or the pools either, so that's a good thing. Now, camps are largely outside. The numbers have been greatly reduced compared to what we normally do, but we're not seeing that spread from our pools, and we're not seeing that spread from the camps. So that's also a good thing that we've been doing it, and we're not seeing those any spread yet. Sheila, as a data analyst, I agree. I like to look at the numbers. That ICU number in particular, I've been focusing on every single week. I want to talk a little bit about. So I talked about parties, and again, I don't want to be a party pooper, but just be very cautious about holding a large gathering or going to a large gathering. And I know it's been tough. We've been denied these things for so long. We want to see friends and family. There's weddings. There's funerals. There's cookouts and birthdays and celebrations, but just please be very cautious. My honeydew cup is on my desk. I had left some from the previous week, so once again I'm powered by honeydew today. Today might be a 2 cup of honeydew a day. So just be cautious about the parties, because that's where we're seeing the spread. And as I said, 30 people at a party can create a lot more spread than 100 people at a restaurant because of the types of interactions and how closely you're interacting people. And I know when I was a kid and we had a family party, every auntie and uncle, everyone's hugging and kissing, and you're all close, and there's 15 people at a table for 6, and there's 19 people in the living room for 3, and we don't want to lose those family connections, but we just want to be cautious that that creates a lot of spread of COVID. I want to talk a little bit about what happens when I have my notes disorganized here a little bit. What happens when somebody ends up testing positive for COVID in the workplace? And it's any workplace, site-specific, schools, retail buildings, restaurants will have slightly different protocols. But in general, so let's take the town hall, for instance, what our process will be going forward. If an employee tests positive, the health department does that contact tracing, just like they always do. So they do that investigation. They find out, okay, who were they in close contact with, who they weren't. They have their timeline set for when they need to ask people to quarantine. And we then would do a cleaning of the facility. And it's not actually going to be a whole facility. So if it were to happen here in the manager's office, we may shut town hall down for a day. We may just have the janitors come in and clean this office. The CDC has really done more and more research and found that the surface spread of COVID really is not a substantial concern. It's really a person-to-person spread. Now, I could cough onto a doorknob, you could touch that doorknob and then touch your face, and that's absolutely a possibility for somebody getting sick. But what we're seeing is the spread is really in that person-to-person spread. So you may have something similar in a classroom, and again, there's specific guidelines out, but somebody tests positive, you would close down, maybe everyone would go home for a day. Who gets tested is determined by the health department's contact tracing, and the who has to quarantine would quarantine. The facility will get cleaned by in-house staff. A lot of organizations, including us, were doing these really detailed cleanings of buildings right when everything started happening, and we were having special folks come in spacesuits and clean everything. And the science has really come out that other than cleaning the buildings, which is a great thing, that doesn't really do anything. So your regular surface cleaning is all that needs to be done. And we'll have specific protocols coming out for our municipal facilities, our rec department, the schools, and everything as time goes on. But I want everyone to think about that because it's going to be roughly the same in most workplaces and places of public engagement. You're seeing stories now almost every day of this business here closed or this restaurant there closed. Luckily, I don't think we've had any in Norwood yet, although I could be wrong. And let's say a restaurant ends up getting an employee who tested positive. They'll do their contact tracing. They'll probably close down for a day or the better part of a day, do a good thorough cleaning, remove the staff according to the health department who need to be quarantined, and then they'll really open up the next day because there's actually no further risk after that. Now, if you started to see in a given community 50 or 60 of these a day, sure, that would change, but that would likely mean that there's an enormous amount of community spread. So as you begin returning to the workforce and utilizing different services and going into different businesses, expect that to happen. A retail store, what would likely happen, an employee would test positive. They would try to do the contact tracing. Okay, who was there on these times and who was available and did they need to be quarantined or not? Close down, do a cleaning of your high-touch surfaces, and probably open back up within a day or so. That's based on what the science is showing us. That's also based on where we are right now in phase 3, moving towards phase 3.2 or 3.B, whatever we call it. So that'll sort of be the process going forward for most operations. Healthcare obviously is going to be a little different, and certain private businesses and private organizations may choose to go above and beyond that. But I think that's what you'll see as the norm going forward in the workplace and in retail, restaurants, food service, etc., when somebody ends up testing positive for COVID. Now, Frank has a comment or a question about walking the dog and disheartening to see people without masks, including police and public works. They need to be setting an example. While that's true, Fred, and I agree with that, it's important to remember that masks are supposed to be worn when you can't maintain social distancing. So right now I'm not wearing a mask. There's no one within 6 feet of me. There's actually one employee through a door and about 14 feet away. And the way my office is structured, I have 2 seats beyond a wall, and I'm well more than 6 feet from them. So if 2 people are walking, and let's say they're a married couple, or just any couple really, and they're walking their dog, they're not necessarily, if they're in the same household, required to be wearing a mask. Now, I consider it to be somewhat a courtesy to pop your mask up when you walk by somebody. I'm guilty of forgetting to do it sometimes too. I'm walking, I'm not looking, and all of a sudden I'm next to somebody. I try to be good about making sure to pop it up. When you're entering into a building, you need to be wearing a mask. If you know you're going to be around a lot of people, you need to be wearing a mask. I think it's great as a courtesy to throw your mask up when you walk by people, but I'll fully admit I sometimes forget to do it. I'm looking around, I'm holding somebody's hand, I'm paying attention to my phone, and I don't realize that I'm walking by somebody. Waiting in line, in a retail store, in restaurants when you go in and until you get to your table, when you get up from your table to go to the bathroom. I know sometimes I'm sitting at a coffee shop on a Saturday morning that I like to go to, and I'll go to the bathroom 2 or 3 times over the course of the morning. Put the mask up. We're all human. We all forget. I happened to be at one coffee shop where somebody got up and they yelled at them and said, "You can't be in here without a mask." And the poor person had a mask. They had been sitting at a table. They just forgot to put it on. It does happen. So if you're seeing people just walking or riding a bike without a mask on, as long as they're maintaining that 6-foot distance, there's really no risk there, and that's okay. Some people, it's just easier to wear their masks. I think of where we were just a few months ago with mask production and what was available to now, we've got fancy logos on them. We've got them with movies and books, and they're getting more and more high tech. Masks have become widely enough available that we're able to make that a little bit easier. People are able to wear their masks longer. So again, I always encourage you, wear your mask. If you're just out walking yourself, you should try to put it on when you go by somebody. Understandably, we're all human. It's not going to happen 100% of times. Reducing the rate of spread is really about the totality of our actions and taking good faith actions to reduce spreads when you can. So I know that's not a perfect answer, but I think the compliance I'm seeing when I'm in a business, when I'm in a store, seems to be pretty good. It's never going to be perfect. And that relates to our numbers as well. There's always going to be, until there's a vaccine and 100% of people get the vaccine, there's always going to be some prevalence of COVID in the community, just as there's always some prevalence of any communicable disease in the community. What we're seeing is we can manage it well with good practices. Now, come wintertime, that'll be tough because we're not going to be doing the outdoor dining. We're not going to be waiting outside in line where it's comfortable. We'll have to. It doesn't mean those rules will go away, but we'll be spending more time indoors, which may bring people into closer contact. One thought process that's out there that isn't yet backed up in data or any peer-reviewed studies is that some of the southern states that didn't see an increase when we did, in states like Washington, Oregon, and New England, is because we were really indoors in March and April and into May, whereas they're generally outdoors. Whereas now that we're in our summer, we're outdoors, but Florida is hot as heck this time of year, and they're spending more time indoors. No science behind that other than speculation, so take that for what it is. Question from Michelle. A neighbor left a note about a wedding in their backyard. Should they be doing that in your opinion? It depends. Weddings have been canceled, and a lot of people have opted for smaller weddings. So my suggestion or my thought process on that is if they were going to plan a wedding with 200 people, and they're saying, look, we don't know when that's going to be feasible, when we can do that. That's not really safe. We're going to just do a small backyard wedding. That's much more preferable to a large wedding. But it depends on the size of their backyard. It depends on how many people they're having there. Will they be wearing masks? Will they be practicing social distancing? A small ceremony and small celebration with a small number of people is a good thing. But they need to be safe when they're doing it, and we hope that they would be safe. Short of having an enormous backyard, if you start having 40, 50, or 60 people in your backyard, it's better to be outdoors than indoors, but you're likely going to see some spread there if somebody has COVID. Now, in your particular case, if it's your neighbor and they have 58 people from out of town come, and then they all leave, unless the two hosts end up testing positive, there may be no risk to Norwood. But what if somebody there is positive and they spread it to 15 other people and they go to 15 different communities and Norwood is once again ground zero? So I'd encourage them to keep it as small as they reasonably can, understanding that weddings are important life events and life doesn't stop because COVID is happening. But what we don't want is COVID to happen more and have it get worse where we can never do these things or we do have to stop these things from happening. So hopefully if folks are having a backyard wedding, keep it small, keep it safe, and keep it reasonable within the context of the rules. That being said, I do want to address something. We've gotten a couple of complaints about some youth sports groups and different businesses here and there and whether or not people in there were wearing masks or employees were wearing masks, similar to some of Fred's concerns. And it's important to think of, remember, in Massachusetts, there's 7 million people, and there's 30,000 here in Norwood, plus the occasional visitors. And there's no way we can monitor that every single person is wearing a mask every single time they should be wearing a mask. So it's about social compliance. And if you are in a youth sport group or a church or a civic group, I don't think too many civic groups aren't meeting, or if there's a business you like to go to and you see that compliance isn't there, people aren't following the rules, by all means email the health department. But my recommendation is reach out to that business, reach out to that youth group that you're a member of, and let them know you just don't feel safe and you may not be buying their service or participating in the group because they're not safe. Think of a Little League team. If somebody sends us a message and says, oh, I saw Little League not wearing masks and I don't think that's right, we're going to go address it. We're going to go talk with them. We're going to see what we can find out. They don't know where their complaint is coming from. They may feel that all their members are fine with what they're doing and somebody drove by and just doesn't like them and made a complaint. The same thing with the business. They might think, geez, is my competitor doing this? Is somebody walking by doing this? But an honest and heartfelt, you don't have to be mean, and don't call people out in public necessarily. Send them a message or call them after the fact. We don't want to get into arguments about it. But just call a business owner or manager and say, hey, I just want to let you know, I love your business. I go in there all the time. I notice your staff aren't wearing their masks, or people are going there and not wearing masks, and I feel uncomfortable about that, and I really would like to return to your business. Please do something about it. They're going to be 10 times more likely to listen to you as a customer or a participant in that group than they are us, who's just sort of the enforcement arm saying, do this or you shall get into trouble. I mean, I always remind people, there's a whole lot of things that are illegal out there, and we're always having to still enforce things that are illegal. So that sort of social pressure from you, and I'm not a believer in going online and posting on restaurant websites or on other sites that I went into this particular store and they weren't doing anything, I think they're terrible. You don't need to shame people. It's about a community conversation. Just call up the widget store owner and say, hey, I buy my widgets there every week. I like going in there, but your staff weren't wearing masks. And, I think you should address that so I feel comfortable coming in there. Still report it to us. We still want to address it with them as well. But use your power as a consumer and as a participant as well so we can continue that social shift and really make it the social norm. That's what's going to happen. Compliance will shift over time. Michelle's comment, they mentioned live entertainment and running until 11 p.m., so I'm guessing it'll be a larger group. You can send me an email with a specific address and we'll look into that one. That could be a larger group. I caution people against that because that's where we're seeing the spread. Now, it's possible they could have 50 people in their backyard and have a rockin' party and there is no spread. However, we're seeing the numbers, even though they're small, that we're seeing is coming from parties. Do we know how they're policing the quarantine mandate? If you're referring to, so there's sort of two quarantine mandates. If you're referring to the travel mandate, that's still largely reliant on self-monitoring. There are notices at train stations and bus stations. We've had to issue notices to airport tenants that anyone flying into the town, even though we just have a small GA airport, but they're doing it at Logan. So nobody really has the resources to fully ensure that. It's relying on that social compliance. Now, where a lot of that's going to come from is employers as well. So we as an employer have a draft interim policy on what employees are supposed to do. There's some federal laws about time people can take in the okay, so you're talking about the travel quarantine. So what we're doing as an employer, employees are allowed to take a certain amount of time under the Federal Coronavirus Response Act. However, after that, they're not allowed to take time. So if they had to quarantine, it would really be at their own time. So employers are really going to have to be the ones to enforce some of the travel ban if their employees are saying, hey, I'm going out of state. Now, they may not know. Some employers, you don't tell anyone where you're going on vacation, and it's not their right to necessarily know. Some of that will have to come through employers. It'll have to be some of the same social compliance that we're relying on for masks. I mean, take hand washing. I hope everyone washes all their hands on a regular basis. We all are human. Sometimes we forget to do it. It doesn't happen. We could never have a law that requires that. Actually, we could. We could never really enforce a law that would require something like that. But we need people to, focus on what you're doing. And if you've traveled out of state, and there's a lot of folks who are going to be responsible and they're going to travel out of state, and they're just maybe spending time with family. When you're out of state, practice your social distancing, wear your mask. And I realize that might be tough. So you may travel to a state where they're not as big on wearing masks as we are in Massachusetts, and maybe there's a little bit of a political issue there. But it's about the types of behaviors that you're undertaking while you're on vacation. So a perfect example is if I were to fly down to Miami, which I think I said last week, I know they're having a lot of cases, and I was to go to a whole bunch of beach parties and a whole bunch of bars and clubs. I don't even know if they're even open down there, but if I was doing all that for a week, I'm putting a lot of people at exposure. I'm putting myself and my family and friends and community at risk. I'm going to go and pretty much bet that person is not going to self-quarantine when they come back, but they're also probably not washing their hands and probably not wearing a mask. I could be wrong. That's a broad generalization, but there are folks who are going to comply, and there are some folks who are never going to comply. But if I were to go to New Hampshire's exempt from our travel ban, I considered going to Maine. I was going to actually go out of state next week. I decided to cancel my trip, even though it was to Washington, which is not actually on our safe list, but has done very well. I chose to cancel my out-of-state plans. If I was going to a state slightly outside of New York, I don't know, Ohio, and I was going to sit in a lake house and not do anything, if I'm wearing my mask and I'm being otherwise cautious, I'm not putting a lot of people at risk, even though their numbers are higher. If I'm going to go down to Nashville and go in and out of bars and restaurants and clubs and everything, then I'm probably putting people at risk when I come back home as well. Overly broad generalization, and usually overly broad generalizations aren't good, but I'd be willing to bet there's probably some truth to that one. Just because you're traveling somewhere else, and I know we all like to go on vacation and get away, doesn't mean you're getting away from COVID. So that's obviously a challenge. It's got to be self-compliance, and it's got to be the social norm. Families got to make decisions that are based on the best for them. If somebody flew to South Carolina for a few days and then flew back, we may not know. And again, it's about not only the totality of our actions, but your own safety as an individual. So if I flew to South Carolina and I wear my mask and I maintain my social distancing and I just visited a few cultural and historic sites and I did some takeout and I practiced good social distancing, there's no more risk there than there is doing the same thing in Boston or Worcester or right here in Norwood. Other than they may have a higher prevalence there. If you're practicing your good social distancing and your good mask wearing and hand washing, you're generally likely to have less of a spread. The people who just aren't going to care and are going to want to go somewhere and have a party and be irresponsible, I don't know what we can do with those people. Hopefully, they'll think of their community and think of their friends and family and the unintended consequences of doing so. So it's tough with the travel ban. A couple more weeks, we'll see how I believe it technically goes into effect August 1st. So we'll see how it works. My hope is, I don't want to say my hope is people travel less, but my vacation out of state was really just a true vacation out of state. I wasn't going to visit family. I wasn't going back home to where I grew up. I grew up in Randolph, 10 miles down the road, so that's easy for me to do. So I chose to cancel a trip that was not essential. I'll do it next year or the year after, or maybe later in the year if things get better. So I think you'll see some people making those decisions, doing some staycations, maybe staying in Boston or Providence or something like that. Is at least what we're hoping people do. But we need to realize we're in this together. So the more we can do our own actions, understanding that nobody's perfect, we're going to forget our masks sometimes, we're going to forget to put it up when we walk by people, but just trying to be as good as we can to our neighbors is what's going to help a lot of our numbers. But great questions, keep them coming. I've got a few other updates. The library opens August 3rd. I do know we had a few people who followed these lives regularly and visited them until I announced the library was opening. They've now seen no reason to come to any of them, but that's okay. The library will be opening for limited hours on August 3rd. The senior center will have some limited opening next week. Please check with them and their schedule. It is very limited. The Civic is open for the workout room, but it's on an appointment basis. And it's limited to maybe half a dozen people at a time. Town Hall is still on schedule for Labor Day weekend. The elevator is still going well. We have had to convert some of our meeting space to... Sarah's still here. We'll talk about the hospital and the storm in just a few minutes. We've had to convert a few of our meeting rooms into workspaces. It's been further delayed by we also had some flood damage at Town Hall. And we had to replace some carpet and some painting. The Dean Street Bridge is being worked on, so there is a detour there. It's not going to be pleasant for 12 weeks, but there's nothing we can really do about that. Bridges are complicated, utilities are complicated, and I hope that it'll go well. There are some businesses that may suffer a decrease in people being able to get there. I think Stash's Pizza is one. There's probably a few others. So if you normally visit those businesses or you don't, maybe make sure you give them a chance to check out. Roadwork sometimes hurts businesses unintentionally, and it's something we wish we could avoid, but when it makes it more difficult to get to a particular business, anytime if you're doing sidewalk or roadwork in front of any business. So check out all of our businesses, but maybe give them a shot since they may see some trouble with the Dean Street Bridge being down. Our parking lots downtown are all under renovation. We have a great contractor who seems to be going at breakneck speed. The Day Street is almost done. They are tearing up the Talbot's lot now. They've almost finished the post office lot. The theater lot will be next, and then final will be the Town Hall and Town Hall extension lot. We have to wait until we get the elevator completely done before we do those, so we don't have any heavy equipment on the Town Hall lot. But there'll be some, I wouldn't say detours, but some of those lots will be unavailable over the next few weeks, but it's moving quickly, and we're happy to see that it's moving quickly. It's going to really help brighten up downtown. So I'll move into talking a little bit about the hospital, some updates, and I guess not really a lot of updates. We think the ER opening time is probably going to be delayed. We're not exactly sure by how long yet. As the hospital's teams continue to do their demo and their investigative work and their engineering work. A comment from Courtney. You can cut through the Yankee Spirits parking lot to get the Stashes if you enter on Route 1. Same for the Frame Center. Yeah, appreciate that. By all means, I'm going to go ahead and give that a like. Check out the businesses that may be impacted by the Dean Street closure, and we appreciate everyone's patience as we work on that bridge, which was largely paid for by the state through a state grant. So kudos to Mark Ryan and his team for getting the state to pay for that. As I was saying, the ER, we were originally looking at 30 days, 45 days. Now we're thinking 90 to 120. Why the reason for the big jump? The building really did suffer a lot of damage. And one of the challenges, and it's a good challenge, is it's a hospital. So a basement may flood, and you might say, well, we cleaned it up, we dried it out, let's put it back together. There's a different level of different requirement and really a no risk requirement for hospitals. So that's adding to the complexity of the work of what needs to be done, and that's going to delay that a little bit. The plan is still get the ER up and running first, start to bring on board the services related to the ER, and then look towards that next step of what will be probably a rebuilding of a majority of the hospital. Maybe it's only part of the hospital. There comes a point where, because of the standards that you need to build hospitals and clean and repair hospitals too, you start saying, well, all right, well, we've got to replace the floor, and then we've got to replace all the walls, and then the studs, and then the ceiling, and then all the wiring needs to go, and then all the plumbing needs to go, and really you're left with nothing left that you don't replace. So that's a challenge there. We are working with the hospital. I should say we did meet with staff from the hospital in their corporate office this week. They're committed. Things are going to take time, but they've got a big team working there, and they're looking forward towards a new Norwood hospital, and so are we. And it'll be challenging between now and then, but I feel confident that what we're going to have at the end of all of this is something better than what we had. We may be able to get a higher level trauma center. We may be able to get a new ortho center. We may be able to get a more of a world-class facility out of this. That's going to be hard for us in the short term. There's going to be financial considerations for the town, certainly for the 1,400 hospital employees, for our public safety run times. So in the short term, that's all challenging, but it's one of those tough situations where there's not much we can do in the short term except look towards that big picture and move aggressively towards it. We are working with the hospital on getting a COVID testing site back up somewhere. The regulations are a little on the, they're not that strict, but they're strict enough that we've got to find the right site, make it work, come up with the model. So we are working on getting both for our community testing program and just to have testing available in Norwood in addition to the urgent care, so we can have testing certainly in place for the fall. So hopefully more to come on that in a few weeks. Doris, do I have a schedule for the gas work on Moore Street? I don't. You can email the manager's office or just go ahead and email the DPW directly, and they'll be able to give you a more of an update schedule on when gas work may or may not be getting done on Moore Street. So in terms of our flood grant or our flood damage grant program and the flood in general, we're probably about 80 to 90% done with our site visits. Once the site visits are done, we can actually start with issuing funds for Tier 1 and then moving on to Tier 2 and Tier 3 applicants. We haven't secured any funding from the state or the federal government yet. I will say the Lieutenant Governor's office has been particularly helpful in giving some of the state bureaucrats a boot in the butt to make sure we can use the money that we have available. So I do appreciate the Lieutenant Governor's assistance in that. No word on whether we're going to get any money from the state, but the state hasn't passed a full year budget. They've passed a short-term budget. We've still got to dig into that. But we're continuing to work. We've had a lot of town employees and volunteers going out and doing site visits and seeing and visiting the damage in homes in Norwood. It's been substantial. And there are a lot of people who had a lot of damage to their homes. We know that our little grant program won't cover even probably maybe even 10% of the damage that's out there, but we know we'll be able to help some of the most damaged homes and the neediest in terms of looking at their income and their family size. But it's really a terrible thing that happened, and we hope at some point the state will come through with money as well as just bureaucratic assistance. But we are moving forward on that. And of course, there was a lot of business damage in the hospital. I'm still shocked when I talk to folks about the extent of damage at the hospital and the hospital being down, and I get oh, we just thought there was some flooding in the basement. I did have a state official who had asked me and just said, I'm just ask the question, but is it really the town's responsibility to pump out people's basements? And I said, well, we fundamentally have a difference of opinion on what public service is about and what we should be doing for residents in a time of need, but that's neither here nor there. We'll continue with the working through the flood grant program. We've had a couple of our interns. We've had some temp staff. They've done a great job. Some of our officials have stepped in to help us with the grant application process and review process. I mean, we've had the treasurer's office, animal control, admin staff at the police department, finance commission members. I mean, we're pulling everyone around that we have. Library employees were helpful, helping out really everyone in just trying to get these site reviews done as part of our grant process. I mean, that in a short period of time, we were able to pull together a $500,000 grant process and go through all of this work has been pretty incredible. It's a testament to the care that Norwood employees and officials have for the community and our ability to actually operate and get things done. And it's been challenging, but we're helpful. We're working towards it. Sheila, yeah, I had to rent a dumpster. I hope you did submit for the grant application. You may be able to get some funding for that depending on which tier you fall in and the cost. One of the things we found that was helpful for a lot of homes that we would do different next time was actually opening the dump up for construction debris related to the flooding. We saw some incredible numbers by doing that. And we know that some folks did, unfortunately, Sheila, some folks did have to rent rented dumpsters, but we found that that actually helped a lot of folks. Now, some folks may have wanted to take advantage of that, but you got to get stuff out of the basement quickly. If you have two small cars, I always used to drive a Corolla. I don't know how much damaged material I could put in my Corolla and bring to the dump. I'd be making 15 million trips with it. But if this were to happen again, and you never want it to happen again, but you're always thinking about when you have a disaster, how do you A, prevent it next time, and B, be better prepared? That's probably something we would do quicker and more aggressive to help cut down on the cost, because I'd rather pay to repair people's houses than just offset some of the dumpster cost. And unfortunately, some companies, they may charge you A, and then when the demand gets shot up locally, the costs start going up through the roof. But like anything, it's tough. I mean, we helped pump out some basements for some folks who had some mobility challenges and some of the elderly. Our ability to do that is always very limited. So if there's 500 that need to be done, we could ever only do a handful at a time. And if we went out and bought a ton of pumps, if we went out and bought 500 dehumidifiers, chances are they'd sit in a warehouse somewhere, and we don't really own any warehouse storage, so I don't know where, but they'd sit there for 20 years, and then somebody would end up throwing them out because they no longer work. So that's one of the challenges we have with emergency preparedness. And incidentally, that relates directly to COVID. For years, most emergency planning around pandemics, because there has been a lot of planning, the word from FEMA has always been that local cities and towns shouldn't worry about stockpiling materials because FEMA will come and will have plenty of materials for everyone. I don't know why that didn't happen this time. I don't know if the National Strategic Stockpile was particularly low at a given time. I don't know if they didn't envision something on this scale. I don't know if we haven't been funding it appropriately at the federal level. All of that is certainly a possibility. I'm not sure exactly what the hiccup there was, but I would hope going forward we don't want to hoard things unnecessarily. We'll certainly be a little bit more prepared here at the local level, but you'd like to rely on when the federal government says, don't worry, something like this happens, we will be there to help you out with materials, and then that was not necessarily the case. I want to talk a little bit about a vaccine. Not that I'm a scientist and understand exactly how such things work, but we all read in the news that Moderna is close and they're starting their, I think, phase 2 trial. We get no more information than anyone else does on Moderna. Although I keep keep reminding them that if they're successful, and we all hope that they do, that Norwood gets appropriate credit. They didn't like the idea of calling it the Norwood cure, but obviously my job is to advocate for the town of Norwood in all things. But we do talk to them regularly about some of their operational issues. We don't know any more about their research or their prospects than you read in the news. That being said, we read the news as everyone else does, and we're certainly hopeful that it'll be successful. We'd love to have that win be a Massachusetts-based company in a Norwood manufacturing facility that gets that win for the world on that vaccine. What we're responsible for on our end, and we've actually engaged in this type of planning for years, is how would a vaccine roll out? And it actually sort of rolls out the same way we do our flu vaccines. We would establish one or more sites. Your essential employees and first responders always sort of get the vaccine first, and then that includes, for instance, nurses and doctors. They are then the ones giving the vaccine to others. You start with your more compromised populations who need it first, generally, and we're going on the assumption that, from what we've heard, it would go the same way that a flu vaccine operation goes. And then you set up mobile vaccine sites, and whether you then start doing it for the general public, and you have folks come in and they get vaccinated. That we could actually get up and running fairly simple. What we need is the actual vaccine, which nobody has yet. There isn't one out there, to my knowledge at least. And then it needs to get produced in sufficient quantities to be able to do that. So that's all fairly timely. What you're seeing around the world, though, is a lot of these companies and organizations are gearing up their manufacturing operations. They're gearing up their storage operations to be able to do this. And there's a whole lot of countries racing to be the first one with a successful vaccine for obvious social and, I'm sure, financial reasons. An episode of a favorite TV of mine shown years ago said that it was a police show. They said the police have the ability to solve virtually any crime out there. It's just a matter of resource allocation. And that in this particular case, they weren't finding a wedding ring that was lost for somebody. I would suppose, and this is just speculation, and what we've discussed in our team is it's much the same with a vaccine. The whole world seems to be focused on getting a vaccine found. on getting one developed. So with so much money and so much effort and so much resource being towards it, we're hopeful that something will happen, that hopefully Moderna studies will go well, or some of these other company studies will go well, and they'll be able to get it out there in the public. What will the world look like post-vaccine? What healthcare facilities, I don't know, if I knew I'd probably be a billionaire, but what healthcare facilities generally do with the flu vaccine pre-COVID is if you did not get vaccinated, you'd usually have to wear a mask. If you didn't wear a mask, you'd have to if you didn't wear a mask, you'd have to have been vaccinated. You may see something like that down the road, 6 months or a year, where workplaces say, hey, if you've gotten your coronavirus vaccine, you don't have to wear a mask. You may still wear a mask just as a precaution, but that would allow us to go into some of those phase 4 events, the big weddings, the big sports gatherings and concerts and other things like that. There may be requirements, and this is complete speculation on those, whether you need a vaccine to do A, B, or C. What we're focusing on the back end is making sure that we're planning and we're prepared if there is a vaccine announced and it does be getting shipped out, that we can do our part and make sure that that gets out expeditiously to the public according to whatever regulatory framework the CDC and the Mass Department of Health come up with, but we assume it will follow how we normally do our flu vaccines. And we've planned for mass vaccinations and mass inoculations in the past. It's all been part of emergency planning for many years. It just doesn't always work the way you intend it to. So as Moderna begins their phase 3 trial, we're hopeful, and hopefully they'll keep up the good work, and we'll see something sooner rather than later, and they'll be able to put it into production, and it'll be safe and usable by all. Their initial reports look good, but I say that as a novice who's only read their reports in the Wall Street Journal, and I'm not otherwise an expert on whether or not vaccines are successful. I also still don't completely understand the science behind Moderna's vaccine, but that's why they're a RNA therapeutics company, and I am a government employee, I guess. But it's pretty complicated and fascinating stuff. So I believe I have covered my material for today. I will go through a quick review, and we'll, of course, take any questions in the comments. I'll do a quick review to make sure I've covered most of the comments. I believe I have so far. So we talked about our COVID numbers being low, the weekly count showing 0, but we want to be careful that small fluctuations of 2 or 3 or 4 or 5 may seem like they're big statistic fluctuations, but they're really not. And we need to wait for trended data over the course of days and weeks. Our percent positive rate is 1.2%. You're doing great, Norwood. Parties, don't have them. There's no restriction on parties, but please be cautious about large gatherings. That is where we are seeing the spread at a local level, and we believe even at a state level. So please be cautious. Take precautions. Everyone wearing masks at a party would be helpful. Social distancing is helpful. Regular hand washing is helpful. Not having them at all is helpful, or keeping them to small groups. I mean, 6 or 7 people or 8 people sitting around a fire is not a big deal. If you're practicing your social distancing, 50 or 60 people in a backyard might be a problem. So please, I know it's been tough, but try to keep numbers low. That's where we're seeing our spread. Library opens August 3rd. The Civic is open for the workout room. The Senior Center will be opening next week on a limited schedule, so check their website out or their webpage. Town Hall still on schedule for the 4th of July. You can tell where I am. Still on schedule for the right after Labor Day. The Dean Street Bridge is under construction. Please visit some of the businesses in the area that have been impacted by the closure there as their traffic drops a bit. The parking lots downtown are going great. Incidentally, if you haven't had a chance to check out Central Street or some of our outdoor dining, I encourage you to do so. The Wi-Fi is up and running on Central Street. The sound system will be there at some point before I retire, although it seems to continue to get delayed, but we will get it out there. We've started painting some of the barriers, so every week we try to add a little something up. In terms of the hospital, as we've said, there will definitely be a delay in the opening of the ER. We're still hoping sometime in that September timeframe, but as they continue to open up the building and do their investigation and their analysis and do their demo work, there's a lot of work that needs to be done. But I got to tell you, they have done an incredible amount of work. They've had contractors in there 7 days a week, and it's just incredible walking through all the different demo work that they've already done for floorboard and everything else that could be mold bearing. The ground level where a majority of the water flooded in is looks like it's new construction in the sense that it's been completely taken down to its frame, but the building systems really took a whacking. I don't think you could have damaged a building better if you tried. But we're also working on a testing site with Norwood Hospital. We think we'll have, along with the hospital, sort of a conceptual framework of what the new hospital is going to look like. I don't think we can quite call it a new hospital yet. We don't know. That decision hasn't been made. But we're anticipating, and I think Steward's anticipating, that there's probably going to be major reconstruction of at least the LaRusso wing, if not the entire facility. That'll be challenging in the short term, but in the long term, that's the best possible thing for the town, and we look forward to working with Steward on that. We're finishing up our site reviews for our flood grant program, and then we'll be able to get funding out in the next week or two. Question from Deborah. Are concerts on the Common returning? We had initially booked a few of them for late August, and then a few of the bands have changed or said they weren't sure they can make it. So it's up in the air, but we'd like to if we can. We may look at doing something similar on Central Street. Maybe I know we're looking at doing a couple of sort of movies on Central or movies on the Common. So our goal was to have some August or September concerts on the Common. We're just now trying to line up the bands and do it in a way that is safe. People usually, when they do the concerts on the Common, actually practice pretty good social distancing already. So we know that'll be won't be an issue. It's just some concern being some of the bands are larger and so many people being in such a small spot on the Common. But we think we'll be able to do at least one or two in August, and we're looking forward to that. I do know that the Carillon concerts are ongoing, so we can get the schedule posted to the website if we don't have them. But Lee and his team of Carillonneurs from across the state, many of them are Norwood residents as well, have been keeping us entertained with the Carillon concerts, but we believe we can get concerts on the Common returning as well. One other update, I mentioned this earlier. This is our chart. We did flatten the curve. We got to keep it down, but if everyone remembers back to when Flatten the Curve was all the rage, we were successfully able to do that here in both Massachusetts and in particular in Norwood as we saw our numbers jump down. I was showing this to somebody the other day, and they asked if I was included in that 6 number or the 11 number, and after talk with the health department, I believe I'm one of that 6 number there, but I might be in the 11 number, as I did test positive myself for COVID, what seems like a lifetime ago. That's all I have for updates. I'd be happy to take any questions folks have in the comments. We usually book these for about an hour. We're at 47 minutes, which is usually where I get tired of talking or folks get tired of listening to me, but I'd be more than happy to take any questions about anything else going on in the town or anything COVID related. I do believe next week, we got the Carillon concert schedule there. Thank you to Stephen, one of our extraordinary interns in Town Hall summer staff. Mr. Cooper will be likely doing the Facebook Live next week. I put it to my department heads to vote on who they think should do the Facebook Live next week while I'm on vacation. Conveniently, why Bernie had stepped away from his desk, so the unanimous vote was for Bernie to do it, and he'll likely be doing it next week. If he can't, I'll be able to pop in and do it as we continue to keep updates coming for everyone. Courtney, going to send a request. Carillon request to commemorate the 100th anniversary of the 19th Amendment. We can certainly do that. If we wanted to have a special Carillon concert, I think that's something we can do. By all means, get that email in. And I believe not only is it the 100th anniversary of the 19th Amendment, it's the 200th anniversary of Susan B. Anthony's birthday. Susan B. Anthony being born in Adams, Massachusetts, out in the western part of the state. Conveniently, I used to be the town manager in Adams, Massachusetts, and have been to the Susan B. Anthony Birthplace and Museum in Adams, Massachusetts. Actually, we did not have her birth record. That was with the city of North Adams. Adams and North Adams actually split. And the rule was that Adams got to keep the name. This was in the late 1870s, but North Adams got to keep the records. So Adams being named after Samuel Adams, and some folks would say that the city of North Adams was named after Samuel Adams, and I would always have to remind them that no, the city of North Adams is named after the town of Adams. So that is my useless fact of the day for anyone who's interested, but go ahead and send me that request, Courtney, and we will get something for the 100th anniversary of the 19th Amendment, and maybe we can even have a ringing of the Carillon to commemorate Susan B. Anthony. Other questions from folks. We have the 3 Carillon concerts on there. We're working on the summer concerts. Our parklets are being ordered. They'll take a few weeks. They probably won't be in here until mid to late August, if not a little bit later. We are opening Town Hall first week after Labor Day, but all of our services are available online or via phone or mail. So I'd encourage everyone, continue to look at those services that we have available online. You can pay your tax bills online. You can pay other bills. We can handle every service we offer remotely or online, so by all means, take advantage of them. We are in the next 6 months going to convert to online permitting for building, inspection, and land use, as well as health. So we're looking forward to that. That's a nice update that we're looking forward to as well. And our new facilities department has been combined, or consolidated facilities department is doing great. They're doing great work in a lot of the town buildings and a lot of the school buildings. And a shout out to all of the school staff in particular, the cafeteria workers and the janitors who have been at their buildings day in and day out, as well as some of the administrators, and of course teachers who have had to learn how to work remotely or distance learning. I know the school committee discussed last night that their goal for next year is a hybrid model. The school districts have really 3 choices: all in-person, hybrid, or all remote, and it is a no-win scenario for the school committee and the superintendent and school officials. There is not one solution they can pick that would make everyone happy. I had a conversation with the superintendent today and chided him, and I said that I actually called him and said I wanted to criticize him for his impossible decision, and that I joked that I had prepared my criticism for whatever he had picked, because there's nothing that they can do that's going to make everyone happy. There's no perfect solution. It's a choice of bad, worse, and even more worse. Can I get tags to pick up TVs? Is that something I get at Town Hall? Yes, if you want to just reach out to the manager's office, we will arrange that. It may be a little bit of a mail process. The problem with the stickers is we could go to an online payment process for it. We then still have to go in, take something down, and mail it out to you. But we can absolutely get you tags for all of your appliance pickup. It's just a little bit of a longer manual process. We're looking into what we can do, but again, because it's a sticker we got to give you, once Town Hall opens up, that'll be a little bit easier. We'll probably maybe change where we can get the stickers from, but we'd like to be able to find a way to make that process a little bit easier. It's just kind of a pain in the butt. We did get a question from somebody a few weeks ago. We don't accept personal checks for appliance stickers, and the reason is when the town used to do that, the number of checks that got bounced back it was astronomical. And what would happen is we would take the check, we'd give them the sticker. They got the sticker. She'll email us at managers@norwoodma.gov, and we'll see what process works best for you. We would give them the sticker, the appliance would get picked up, we'd eat the cost, and then the check would bounce. So not only did we get no revenue for the appliance, and that's a cost the town has to bear, we then had to pay a bounce check fee of $25. So whereas we should be getting a $35 revenue to cover the cost of the appliance, we ended up losing that, eating $35, and then eating $25 on top of that. So somebody would get away with free appliance pickup, and then the taxpayers got whacked for, $60 or $70, and it was just not a good situation for us. We're looking into a digital process for it. It'll just be a little bit complicated because it's still something we need to print. Although we might be able to tie it into a system where we let them know to come pick it up. Why not a print PDF option like USPS does? So it's still about tracking it. And again, USPS has resources that, of course, we don't have. The U.S. Postal Service being a national and international organization, we're just a little town in Norwood. So somebody would go online and pay, and then they would print a PDF. I need to make sure that we have something we can verify and that the trash company can verify is legitimate. And that's with one of the stickers, we know that you have that green sticker, they can look at it and it's legitimate. A printed PDF with an information on it, somebody could copy it, somebody could fake it, and it just becomes a little bit of a challenge there. We think we might be able to do it with a sort of a database tie-in, but we're looking into it. We'll come up with a solution probably sometime by the fall, because we also want to look at some of these few things that are lower need or lower use, but people have a need for it, and if you don't have to come into town hall, why not do it? It's just sometimes these systems still end up being a manual process where somebody has to manually log on, do A, take it, go and do B, and then do this, and then send it out to you. But we can likely come up with something by working with the address pickup system in our vendor. Just going to take a little bit of time, but we'll come up with a solution long term to making it easier for trash stickers. Believe me, we have folks who want to come in and get them, and it would be easier if we could have it all be digitized. So that's a good question. Something we're certainly going to work on. All right. Does anyone have any other questions? Again, you can always email managers@norwoodma.gov, managers@norwoodma.gov. We will get back to you. We have some traffic items we're looking at over the next few weeks, and if we ever don't get back to you, just email us a second or third time. Sometimes the email address, the email system does get a little bogged down, and emails tend to get lost in the shuffle. So feel free to email us, especially right now. We have a particularly high email volume. Email us with any questions you have. We'd be more than happy to help. With that, I'll go ahead and end the live. If there's no other questions, you can always continue to ask questions in the comments or email us at managers@norwoodma.gov. We always appreciate that, and we try to get back to you as soon as we can. It's usually Bernie or I or somebody in the office staff that are answering that question. With that, I want to thank everyone for joining us this week. We're going to continue to do these weekly Facebook Live updates. I think even when we get to the post-COVID world, they seem to be a good way to get information out there for folks. We'll probably continue doing them. We did try a few weeks ago. We do want to look at doing an Instagram Live. We're just trying to figure out how to do that without me holding my phone and doing it, which may be what we do. So continue to follow us on social media for updates for the town. Continue to send any questions or comments or concerns we have. Our Citizen Information Center is still open, will be open in perpetuity, and is taking information. If you're having trouble with food or other resources or need assistance, you can call the Citizen Information Center, and or the Resident Information Center, we will get that information to you. Please continue to wear your masks and practice good social distancing to the extent that you can as we continue to keep COVID numbers low. With that, thank you, everyone. Have a great week. I will probably not see you next week. Mr. Cooper will be here with our Facebook Live. So thank you, everyone, and a big thank you to all the town officials and the staff and the volunteers of Norwood and the Norwood schools for all they do each and every day. Thank you, everyone.